Good afternoon and welcome to this community briefing. Joining us once again to provide interpretation is Margie Prop. Thank you so much, Margie, and thanks to everyone who is tuning in today to learn more about the latest local developments in the effort to help end the pandemic. And I want to begin by thanking all of you who have done the single most important thing you can do right now to help end the pandemic, getting vaccinated. As of this afternoon, our county continued to lead the state in the percentage of residents who are fully vaccinated, with just over 46% of Lancaster County residents having completed their vaccinations. And we are pleased by the promise of growth in that number when you consider the fact that, as of today, more than 65% of Lancaster County residents aged 16 and older have received at least one dose. Many have asked, why is it that our community continues to keep setting the pace for our state? And I would point to the care, concern, the commitment, and the compassion that the people of Lincoln and Lancaster County have demonstrated throughout the pandemic. You continue to do what it takes to slow the spread and save lives and livelihoods. I also point to the fact that your care, concern, commitment, and compassion have been matched every step of the way by our local health department and its partners. Since we launched the first vaccination clinic at Pinnacle Bank Arena on January 22nd, our health team and partners have held 62 clinics. This means that the tireless and dedicated local public health professionals, the nurses, the doctors, the nonprofit leaders, the volunteers holding those signs, they've stood up on average one clinic every 1.5 days for the past 13 weeks. That's what winning looks like right now in this extraordinary moment in our community's history. And the noteworthy aspect about winning in this race to vaccinate against the virus and its variants is that winning doesn't come at anyone else's expense. The more we succeed in reaching our vaccination goals, the more safe and more secure everyone across our community, our state, and our nation becomes. And I think about that a lot as a mother. 2 of my 3 children are old enough to be vaccinated. My oldest daughter, who is away at college, just got her first dose yesterday. And I feel so relieved knowing that she is now less likely to get sick or cause someone else who is more vulnerable than she is to get sick. And I also take comfort knowing that because she and my 16-year-old son have had their first doses, and because my husband and I will both get our second doses this week, we are helping to build a web of protection for all of the children in our not yet eligible for the vaccine, including our youngest daughter, who is just 12 years old. I hope that if you are on the fence about why it matters to get vaccinated, you will pause to consider what your vaccination might mean to a child aged 15 years or younger who does not yet have the option of rolling up their sleeve. Here to share more on the subject of protecting our community's youth through school-based vaccination clinics and to give you an update on our local conditions is Health Director Pat Lopez.
Thank you, Mayor. Part of our vaccination efforts right now are focused on students aged 16 and up. Last week, we partnered with local colleges and universities to host a clinic for students at the Coliseum on UNL's campus. We also started holding vaccination clinics at local high schools, and those will continue into this week. COVID-19 vaccine benefits people in every age group, including teenagers and young adults. It provides protection against the virus, prevents illness, and saves lives. It also helps slow the spread of COVID-19 and its variants in our community. Joining us today by Zoom to share further information about COVID-19 vaccine in use is Dr. Sean Jobs-Jost, a pediatrician and president of Complete Children's Health in Lincoln. Thank you for being here with us today.
Thanks for the opportunity. I really appreciate it. And I really appreciate the work that the health department is doing to work with our schools to get our adolescents vaccinated. It's pretty exciting for us as pediatricians and for me personally as a parent to get to see adolescents having the opportunity, older adolescents having the opportunity to be vaccinated. The disease of COVID-19 in adolescents is not typically as severe as it is in older patients.
But we do see adolescents who suffer from some complications of COVID-19, including long COVID syndrome, including heart inflammation, which sometimes limits athletes from participating in athletics. And really just also the limitation to what activities they can participate in. Our adolescents and young adults have been limited in some of the extracurricular activities that they can do, and those are just as important to them as their learning opportunities. And so vaccinating our youth so that they can protect themselves, protect each other, and also protect the rest of the community is really, really important. We also do see some adolescents and young adults who have underlying health conditions that put them at higher risk of complications of COVID-19, like diabetes, moderate to severe asthma, other chronic lung and heart conditions. And those adolescents and young adults are integrated into our population with everybody else, and they are exposed on a regular basis to the rest of the young people that they live and work with. And so vaccinating our community helps to protect them as well. And adolescents live with younger siblings who might be at higher risk of COVID-19 infection. They live with older adults. They see their grandparents. They work in grocery stores and in restaurants as for after-school jobs. And so integrating them into the group of protected, vaccinated individuals and promoting herd immunity in our community is so important. So I'm really excited about that opportunity. And I've been encouraging all of my patients in clinic to make sure that they go out and get their vaccine.
Thank you for that valuable information. If parents have questions about COVID-19 vaccine, they are encouraged to contact their child's healthcare provider. And as I mentioned, we continue our efforts to vaccinate students 16 and up on site at local high schools. Last week, we hosted clinics at Norris, Waverly, and Pius, as well as Lincoln Lutheran, which also included students from Lincoln Christian and College View Academy. We also partnered with Three Rivers Health Department to provide clinics at Raymond and Malcolm High Schools. This week, we're hosting clinics at additional high schools in Lincoln. We started yesterday with Lincoln East and Lincoln High. Today's clinics are at North Star and Northeast, and on Wednesday, tomorrow, we'll be at Southeast and Southwest. All the clinics are for students, their families, and guardians. Dr. Steve Joel, Superintendent of Lincoln Public Schools, is here today to talk more about the student vaccination efforts.
Well, thank you, Director Lopez and Mayor. Appreciate the opportunity very much to be here. It's certainly been a journey, and it seems like we ought to be nearing the end, but of course we're not. But we are taking major steps forward. I want the community to know how much we at Lincoln Public Schools appreciate your leadership, Mayor and Director Lopez. The collaborative effort that we've been able to put together between the school systems, meaning all of the county school systems, as well with the health department and city hall, has been instrumental in getting us to this point. But as you've mentioned and many have mentioned, we still have a long way to go. It's hard to believe we only have 4 weeks of school left. It seems in so many ways that we just started this journey. We're grateful to have been able to keep our schools open, and our remote learning numbers have come down precipitously. I believe our teachers are much more comfortable today than they were when we launched this. But we have 4 more weeks of school left, and we also know we have to be on our guard during that time. I want to call out our staff. Our staff have done a tremendous job this year, and I know most, if not all of our parents and our students understand and acknowledge that. It's been a difficult year, but it's been a manageable year. And one of the things that we're really proud of in Lincoln is that while there's still several million students that have not yet had in-person instruction around the country, I think in Nebraska and certainly in Lincoln, we've done a much better job with that. I want to thank our parents for their tremendous support during this year. And although the pandemic plan raised a lot of questions and certainly caused people to think twice about how safe schools were, I think for the most part our parents trusted us, and I want to thank them for their support. And I want to thank our kids for their great effort. This has been a difficult year for students, and I want the seniors, or at least the parents of the seniors that are listening to this broadcast, know that we're working to increase numbers at graduation. That's coming up here in a very, very short period of time. So over the last couple of days, we've had more than 500 high school kids, students, be vaccinated. In fact, yesterday I was at Lincoln High, and I, as Director Lopez has heard us, many people say with regard to the city clinics, it went off without a hitch. Students were excited to be there. You know, of course, there's always a little bit of student nervousness about getting a shot, but for the most part, they were looking forward to the event, and certainly they know, as several had indicated to me, that the way we're going to get through this is we're going to get more students vaccinated. We're going to get more of their parents vaccinated. Had a chance to talk with a young lady at Lincoln High who brought her mother, who couldn't tell me how grateful she was for the opportunity to participate at the high school clinic. So thank you for making that available. And as Director Lopez mentioned, we have 2 more clinics tomorrow. I want to urge all of our students and staff members that have not yet been fully vaccinated to take advantage of these opportunities. We get a lot of questions on a daily basis about what is next year going to look like. Well, here's one prediction I'll make. We won't have a 600-page pandemic plan like we had at the beginning of this year, but we will have a pandemic plan, and that pandemic plan will reflect where we are as a community with regard to how safe our schools are going to be, because we don't want to become a transmission site for COVID-19. Having said that, the best way to get back to normal, as many people hope and wish for, is to get vaccinated. To get vaccinated and continue to follow the DHMs, wear masks, you know, we go wash hands, socially distance. You know, we're getting some more leeway right now with regard to schools and gatherings and extracurricular participation. We're going to take full advantage of that. But at the end of the day, we want to make sure that our students and our staff and our parents and our community are safe. And we know this, that the number of positive cases within Lincoln Public Schools has continued to drop, not only with students, but certainly with, you know, our close to 77,500 employees. And the number of students that we have to exclude because of close contacts has begun to drop. So I think that plays out in our remote learning numbers that are under 14% today. Many will recall we began the year at over 30%. I believe that reflects that more of our parents have confidence in how safe our schools are. And we know this, with less disruption, meaning less time out of school, less worry about acquiring something as like COVID-19, we can get back more quickly to high quality teaching and learning and meeting all of our students' needs. And that is ultimately our goal. And we also know that that's the community's goal as well, too. So our hope is that soon we can begin to vaccinate those under 16. And I know that day is coming, and we will we'll take full advantage of it. And until then, we're going to continue to just do our part. We feel like we play a critical role within the Lincoln community. And again, very much appreciate being involved in these conversations and having a chance. Director Lopez, you and your staff have been incredible. I want the community to know that. We probably have asked close to 1 million questions. We've sought kind of 1 million workarounds. And at the end of the day, you know, we do what's right for our students and for our staff and certainly for our community. So I'll close by saying that probably sometime in June, maybe mid-June, we'll come up based on the best information we have with the pandemic plan for 2021, 2022. And in the meantime, we're going to continue to work collaboratively with the city and the health department, and we're going to do the best we can. But I want to urge people to please get vaccinated. I want our students to get vaccinated, and if need be, we'll schedule additional clinics. But the reality of it is we have an opportunity now to really not only lead the state in vaccine rates, but maybe set some kind of a state record for pandemic. So let that be our goal. Let's keep working together. And again, I appreciate very much the opportunity to be part of the press conference.
Thank you, Dr. Joel. At the Health Department, we really appreciate our collaboration with LPS and all of our school districts to offer the clinics. And I really would be remiss in not remarking on how how helpful all of our schools have been and how they have come together to work with us as a community to do what's best for our students and for the staff at the schools to make them a safe place. And it's really been a real privilege to work with them in an open environment where we really discuss and look for solutions. So as Dr. Joel said, and I want to remind you, please get your vaccine. And if students miss the opportunity to get vaccinated at their high school clinic, there are other options, including upcoming public clinics or local pharmacies that offer the COVID-19 vaccine. This week, there are 4 larger public vaccination clinics. Tomorrow, a first dose drive-through clinic at Gateway Mall. And on Thursday, a second dose clinic at Pinnacle Bank Arena. And there's a first dose clinic at CHI St. Elizabeth on Saturday, along with another drive-through clinic at Gateway Mall. Residents can register and schedule an appointment for the drive-through clinics by going to covid19.lincoln.ne.gov. Just click on the green registration and scheduling box. Fill out your information, and when you click on your preferred vaccine at the bottom of the form, you'll see the dates of the upcoming clinics. Click select, and then you can schedule a time. People who are already in the registration system will be contacted to schedule an appointment. We are also partnering again with the Asian Community and Cultural Center to host a smaller scale clinic on this Friday. As we look ahead to the next few weeks, you will see an expansion of smaller scale clinics in the community. We have worked with partners to host several successful clinics in our community, including clinics at long-term care facilities, churches, and cultural centers. And we will continue to hold larger clinics, but we are also continuing to work with various partners to host neighborhood clinics. These clinics will provide residents with additional opportunities that help make vaccination accessible, convenient, and close to home. We have 2 neighborhood clinics scheduled for the next week. One is Tuesday, May 4th at the Air Park Recreation Center from 3 to 7, and the other is on Wednesday, May 5th at the Belmont Recreation Center from 4 to 6 p.m. We will be working with partners and others on outreach to area residents and businesses about the clinics. We are finalizing additional dates and locations for more neighborhood clinics and will provide that information in the near future. We continue to encourage people to get vaccinated at the first opportunity. Every person who completes vaccination brings us closer to reaching our goal of having 75% of our community 16 and over fully vaccinated. As of today, more than 162,000 residents have received 1 dose of vaccine. That is more than 65% of our population aged 16 and up. Almost 114,000 residents are now fully vaccinated, taking us up to 46%. We're making steady progress and must maintain our forward momentum. We'll continue to see percentages rise as more people are vaccinated, especially in some of the younger age groups who recently became eligible for vaccine. I also want to provide a brief update on the Johnson & Johnson vaccine. On Friday, the Food and Drug Administration and the Center for Disease Control and Prevention recommended use of Johnson & Johnson vaccine resume for people 18 years and older after the temporary pause. Both federal agencies recommended a pause in the use of Johnson & Johnson vaccine based on 6 reported cases, including one in Nebraska, of a rare and severe type of blood clot in women after receiving the vaccine. All 6 cases occurred between the ages of 18 and 48. We joined many other health departments across the country that immediately paused the use of this vaccine. During the pause, medical and scientific teams to the FDA and CDC examined all available data. The review shows that the known and potential benefits of J&J vaccine outweigh its known and potential risks. However, the CDC and FDA note that women younger than 50 years old should be aware of the rare but increased risk of the condition, and that there are other COVID-19 vaccines available where this risk has not been seen. We reviewed the findings and consulted with the state, and we are planning for a Johnson & Johnson vaccine clinic and to be held on Saturday at the drive-through clinic at Gateway Mall. Last week, the COVID risk dial moved to the low yellow for the first time. This was a slight improvement after being mid-yellow for 9 consecutive weeks. Local data continues to hold steady and make small incremental improvements. So this week we are remaining in low yellow on the dial. This indicates a moderate risk of COVID-19 spread and impact in our community. We continue to see improvement in the number of new weekly cases of in Lancaster County. On this chart, the blue line shows the weekly case count, and the yellow line shows the trend downward. We have seen a decline from 420 new cases the week ending February 6th to about 300 new cases at the end of last week. That was ending April 24th. This was a slight increase from the 264 new cases reported the week ending April 17th, but the overall trend is encouraging. We also continue to see a small increase in the number of COVID-19 patients hospitalized locally, but the current increase is mainly due to patients from other communities. The 7-day rolling average of local hospitalizations increased from about 25 the week ending April 10th to about 34 last week ending April 24th. And at a closer look at the data, it shows that COVID-19 hospitalizations of Lancaster County residents have actually declined slightly over this time frame. This is represented by the orange line, and you can see the decline from about 22 the week ending April 10th down to about 20 the week ending April 24th. This can be attributed to the success of our vaccination efforts, especially for those over the age of 65. Over 78% of our residents aged 65 to 74 are now fully vaccinated. As I mentioned earlier, just over 46% of our population aged 16 and over is fully vaccinated. That moves us to the orange category for the vaccination metric. To get into the yellow category, we need to have 60% of the population 16 and older fully vaccinated. And the vaccination metric will move into green when we reach our goal of having 75% of the population fully vaccinated. We are on our way. This week we have reached over 65% of our population aged 16 and over who have had at least that first dose of vaccine. Also this week, we now have 3 age groups that have reached the 75% mark for initiating vaccination. Over 75% of the residents aged 85 and older have had at least 1 dose. More than 80% of the residents aged 75 to 84 have had at least 1 dose. And nearly 86% of the residents aged 75 to 74 have initiated vaccinations. In addition to the progress of initiating vaccination, this chart shows that the progress we've made since the beginning of the year related to the percentage of our population 16 and up who are fully vaccinated. As you can see, at the end of January, we were at just 4.9% fully vaccinated. At the end of February, we increased to 12.2%. Then at the end of March, we moved to 23.9%. And as of yesterday, we reached over 46% of those 16 and older that are fully vaccinated. As more people return to receive their second doses, we will continue to see that fully vaccinated percentage catch up with the initiated vaccination percentage. Thank you to all of those in the community who are getting vaccinated and helping us to reach our goal. With the COVID-19 risk dial remaining in low yellow, we are still asking everyone to maintain caution. The variants do have the potential to cause COVID-19 to be more severe, spread more easily, require different treatments, or change the effectiveness of the current vaccines. We encourage everyone to get vaccinated now. The vaccine is the way we are going to overcome COVID-19 in our community. With that, we'd be happy to take any questions.
Hi, Pat. This is Matt Olberding with the Journal-Star.
Hi, Matt.
Hi. I just wanted to ask, I noticed that vaccination numbers have gone down quite a bit over the past couple of weeks, especially the initiated vaccines. Is that a concern at all as you get into those younger groups, maybe fewer people being interested in it, or do you feel like as you have more of these sort of outreach clinics where you go out to people instead of having them come to you, that'll improve?
We do expect that to improve. We're trying to get out in areas, as I mentioned, one of the things we've done is that Tabitha is providing vaccine to those that are homebound. But we also knew that there would be a time, we had always planned to go out into the community and have neighborhood clinics from the very beginning. And now we've reached that point that we're at that place where we can make it more convenient and more accessible for people to easily get the vaccine. And we expect to see us continue to incrementally go up, but we're not going to go up by 8,000 at a time or 30,000 doses a week as we've done in the past, as we're moving down through the population.
And so would you expect that your focus going forward is going to be more on those smaller neighborhood clinics, community center clinics, as opposed to the large clinics at PBA?
Yes, at this point, we expect to be working with the neighborhoods. We're working with our Black ministers to hold another clinic. We're working with El Centro for some other clinics, but we're also working with other recreation centers and other areas of town to really reach people where it's not as convenient for them to come in and get vaccinated. So at this point, that's what we anticipate doing.
Okay, thanks.
Mm-hmm, mm-hmm.
Any other questions for our guests or Director Lopez or myself?
Hi, Alexa with Channel 8 here. I have a quick question for Director Lopez.
Okay, she'll be right back.
Hi, Alexa.
Hi, okay, so quick question. Busy weekend coming up. We've got the spring football game and then also the Lincoln Marathon. I don't think the city has seen big events like this since, pre-COVID times. As health director, do you have any concerns about, these big events happening this weekend?
Of course, we'd be concerned. We want people to have fun, but we want them to do it safely and continue to help us move forward. But we've worked quite a bit with both the university and holding the event and the marathon to do it as safely as possible. And we put additional information out there. And so we expect people to continue to follow what they've been doing and enjoy themselves.
Great, thank you.
Mm-hmm, mm-hmm.
This is Brent with Channel 8. I don't know if this is more for you or for Dr. Joel or both maybe, but you mentioned, starting at least in LPS schools this week doing the vaccinations, and if there's only about a month left of school, is that going to kind of put you up against the clock in order to get some of those the second doses done before students flee for summer vacation?
No, Brent, because the students are receiving, as you know, the Pfizer vaccine. So in 3 weeks, they'll get their second doses. So that's why we worked quickly to be able to get these scheduled and get them in the school. And not only have we seen parents at the high schools, but I think I mentioned before, we've seen parents in a lot of our clinics at Pinnacle as soon as the vaccine became available for those 16 and over.
So you're confident that won't be an issue? You'll be able to get everyone's second dose done?
Oh, we're definitely planning on it. We've already got days scheduled. So we're going to make sure that those students receive their second vaccine.
Thank you.
Mm-hmm.
Hey, Pat, this is Matt Olberding again. That made me think of a question. Speaking of second doses, have you guys had much of an issue with people not coming back to get their second dose within the scheduled time period?
You know, Matt, thanks for asking that. That is a really good question, and we get asked that a lot. Our team, as a team, we talk about that. We have had a tremendous response to people getting their second dose. Well over 97% of people have come back for their second dose. And then we reach out to those who don't return, and there can be a variety of reasons. You know, life events happen for individuals, and then we work them in somewhere else. And we have people that reach out and call us if they've missed their appointment somehow. And I also want to remind people to please check your junk email or your spam to make sure you haven't gotten a notice from us to come back in for an appointment.
Thank you.
Mm-hmm.
All right. If there are no further questions, I'll just say once again to thank Dr. Joel for his leadership with the schools. Thanks to all of our educators who've been partnering with the health department. Thank you, Dr. Jones-Jobst. And of course, thank you to Director Lopez and her team. Thank you to you, all of you who have been tuning in and wearing your masks and washing your hands and watching your distance and getting vaccinated. That's a winning combination in our collective efforts to defeat the virus. And on behalf of the youngest members of our community in particular, I offer you the deepest gratitude. Thanks so much. Thanks, Margie.